Welcome, everyone. Good afternoon. I am Dan Levine, Senior Officer for Tokyo Development Learning Center. To kick the event off today in terms of OBA, output-based aid and results-based finance, I would like to introduce Tsukagoshi-san, our special representative for the government of Japan, or for Japan for the World Bank Group. Please present some open. Tsukagoshi, please.
Thank you for the introduction. Just in case, we do have simultaneous translation, and therefore you're welcome to ask questions or offer comments in Japanese language, and I will also greet you all in the Japanese language. So this is TDLC, the Tokyo Development Learning Center. Thank you for coming to today's meeting co-organized by TDLC and Tokyo office event. Just to introduce about the TDLC, we were established with the support of the Ministry of Finance. TDLC was established in 2004. Ever since then, using this teleconference system, we connect ourselves with the country offices of the World Bank Group or with research institutions across the world, and online learning programs have been implemented. So at TDLC, our activities have been upgraded and renewed from last year, and therefore at this TDLC, the focus is on infrastructure, urban development, or city-to-city collaboration. We are trying to be a forum place to exchange knowledge and share experiences. We are trying to disseminate practical knowledges that are directly related to development assistances that the World Bank is doing across the world. So today's seminar is a series of such activities. Today, we will hear from Practice Manager of Social, Urban, Rural and Resilience Global Practice, Ms. Carmen Nonay, and Lead Infrastructure Specialist, Ms. Catherine O'Farrell, on OBA, output-based aid. They will talk about the achievement as well as the remaining challenges. There will be cases of Indonesia, Bangladesh, and Kenya that will be introduced. These locations are connected online today. Ms. Carmen Nonay, as I mentioned last year, ever since TDLC upgraded our program, she has been the manager in charge of this activity. Ms. Catherine O'Farrell, in order to promote output-based aid, in 2003, inside the World Bank, Global Partnership on Output-Based Aid was established, and since then she has been the head. Just in case output-based aid, I am using my own Japanese translation, but in some places, result-based aid is also used, and therefore achievement-based could literally be the Japanese language. I, in fact, searched on the Japanese Yahoo. There was only a few results searching for output-based aid. A former World Bank worker was writing about the solar power generation in the rural area of Bangladesh. Those were some of the few searches, and therefore there are very few that I can search online, and there is no established official translation in the Japanese language, so I was concerned that maybe output-based aid concept is not known very well amongst you. So today we will learn about output-based aid, what it means, and the concept. It will be explained. But if I may, since this is a precious opportunity, please allow me to briefly look back at the transitions or transformations in the form of development assistance where the World Bank has been involved. It was around 2000 that the Japanese ODA value peaked out. There was a shift of focus. Rather than an input, a focus of how much money to input, there was a shift to what kind of aid should be provided and focusing on the output or the outcome. The focus or the interest shifted to the output and the outcome in the development community. This was around the same timing when goals to measure the effect of development had to be established. And at that time, MDGs was established. So that was the time back then. Establishing these criteria meant that donors and recipient had to be partners. Donors and recipient were required to share strategies in order to achieve the development goals. At the same time, recipients were also required to take the ownership and take the lead for effective development, and therefore comprehensive development framework CDF was established at the World Bank, and RSP, Poverty Reduction Strategy paper, was also introduced at around the same timing of these changes in the shift of perspective. So with this background, development aid activities have to be monitored appropriately, and based on predetermined criteria, the outcome should be measured and assessed based on the assessment to developing economies to the recipient that have managed to achieve the goals. More fund should be allocated. That way of thinking has spread. So after this timing, about 15 years have passed, and as of today, last year, the new SDGs were adopted. Amongst the multilateral financial institutions, the major challenges are how to deploy more private fund, as well as domestic fund mobilization are also the challenges. And therefore, what would be the position of output-based aids going forward is what I'm interested. I would also like to personally follow the movement in this area. So Indonesia, Kenya, Bangladesh are connected online, as I said before. We will listen to actual cases of output-based aid. I hope that this event will allow a deeper understanding about this concept here in Japan. Thank you for joining us. Thank you.
Thank you, Tsukagoshi-san. Hopefully that we can define OBA for within the Japanese market as well today. I think it would be a very good, interesting point you raised in terms of actually defining output-based aid within the context of Japan. At this time, I'd like to invite Carmen Nonay, our practice manager for the Partnership and Resource Mobilization Unit of Social, Urban, Rural, and Resilience Global Practice of the World Bank Group, for some opening comments as well. Carmen, please.
Thank you. Konnichiwa, but I'm afraid you will have to use the translator with me. That's my limited Japanese. Thank you, Yasu-san, for the introduction. I feel privileged to be here today because I have what I will call my two kids here. Both TDLC and GPOBA are the largest units that I have reporting to me, so they're like my twins, and it's fantastic to be able to have both of them together. Thanks to the facilities and the convening efforts that the TDLC has, it's a privilege to be able to be here to talk a little bit about what we have been doing in output-based aid, which is a results-based financing mechanism since 2000, as Yasu mentioned. And I think what is very important is that RBF and OBA is really an innovative mechanism. As Yasu pointed out, the bank moved from trying to pilot something beyond what was input-based. And I have to confess, the first few years, it wasn't easy, right? Because there are procurement rules, there is fiduciary requirements. But OBA, thanks to GPOBA, has really done a groundbreaking within the World Bank Group. As a matter of fact, is one of the few practices or global partnerships that has IFC as a donor. So we talk a lot about the World Bank Group, about the different institutions, but IFC is actually the second largest donor that GPOBA have. So a lot of the work that is being done is not only with the public sector, but also with the private sector and PPPs. So again, it has been an innovative mechanism. Also, just to give you a little bit of an idea about GPOBA, it's a partnership of around $330 million, and they provide subsidy as well as technical assistance. And as a matter of fact, they have benefited so far 9 million people. Of course, when I talk about 9 million people in Tokyo, when I know how many inhabitants you have, it's peanuts. But in the big picture, as you know, there are many countries that they don't even have 9 million people of population. So this really is to the good work that GPOBA has been doing. GPOBA has been supporting projects in both infrastructure and the social sector. So in infrastructure from water and sanitation, and you're going to hear two of our colleagues connecting from Nairobi and Bangladesh talking about this sector, but also in energy, also in solid waste management, and in health and education. So it really cuts across the different sectors that we have in sustainable development. Talking about SDGs, I really like that you point out how we're now moving to SDGs because, as you know, they were just incorporated or they were just accepted or endorsed recently. And actually, there is 6 of them that really cut across of what GPOBA wants to do. GPOBA is really to provide access to basic service for the poor and try to do it in the more results-based orientation or way that we can. So without, stopping you from hearing the real staff talking about what they have done, and before I pass it to Catherine, I would like to talk a little bit about the 3 colleagues that we have connected. We have from Indonesia, Talita Yuwono, who is an Indonesian national, senior urban economist working in Jakarta. And Nandia joined the bank in 2009, working on the preparation of local government and decentralization project, the LGDP. And actually, where they're going to be talking about is how we provided technical assistance for the independent verification agent of this project. And it was actually the largest technical assistance, almost $1 million, that GPOBA have done up to that point a few years ago. So this is a project that also cuts across different areas in the urban spectrum. Our next colleagues are connecting from Nairobi, Mr. Nahason Muguna, who is Technical Director of the Nairobi City Water and Sewerage Company, so he's one of our clients, and Mr. Johnson Randu, the Finance Director of the Nairobi City Water and Sewerage Company as well. And it's very important, I think, to get a sense from our clients of how it has really worked, because sometimes we get into the details of trying to do OBA and RBF and we really forget what is the benefit for the clients. And last but not least, from Bangladesh, we have Ms. Rokeya Ahmed, who is a water and sanitation specialist in our Dhaka office, and he has around 24 years of professional experience in microcredit, gender and development, as well as private sector development. So I don't want to stop you from listening to the real stories of what we have really done, so I'll pass it on to Catherine. Thank you very much.
I'd like to thank Yasusan for the very strong introduction that he gave us to the evolution of results-based approaches and how this has been working in development finance. And thanks to Carmen Nonay for the introduction to GPOBA and also to our colleagues who are connected in the other offices. We're going to start with just a very brief video animation that will show you a little bit more in a fun way about OBA and RBF.
Traditional international development financing goes like this. Money goes in, gets spent as quickly as possible, and development activities happen. In the best cases, water supply systems are built and education programs have good outcomes. In the worst cases, nothing happens, and the money and effort goes to waste. Sometimes it's not even clear why or how a project fell short, which often means a missed opportunity and not much learned. Because budgets are tight and there's more focus on what's being spent, more and more people are turning to a new way of financing, results-based financing, or RBF. Would you pay 100% for something without knowing when you might get it or whether it works? Of course not. RBF follows that same principle. Service providers are only paid when they actually drill that well or educate those children. RBF makes sure that at the very least, the desired development outcome happens. It rewards innovators who deliver on time and on budget. And if you want to ensure basic services reach the poorest and often excluded consumers, there's a specific RBF instrument you might want to try. Output-based aid, or OBA. OBA adds a third party to verify service delivery and quality. This gives donors and governments the certainty that their money is being spent on actual lives improved. OBA can work in many sectors like energy, water, sanitation, education, and health. It costs more for service providers to reach some people for reasons like geographic location or inability of the poor, whether in rural or urban areas, to pay the full cost of such services. OBA is a tool to finance that gap. In doing so, projects not only make sure that service providers are properly compensated, but also that the previously unserved get access to basic services they need to improve their lives. When designing your next development program, consider the benefits of results-based financing and output-based aid. To learn more or to join our community of practice, visit gpoba.org.
So this brief animation gives you an overview of an idea of the way that OBA works. The idea here is to really give you a little bit more detail of how it is that this has evolved over time. As mentioned in the very beginning, with large infrastructure investments, there was really the idea that everything would flow from inputs and results would be received. But the large infrastructure investments over time, it was clear, needed some more results-based approaches. So in the 1990s, there were early RBF pilots in conditional cash transfers, such as in Mexico, where there were projects for education and health, and in Argentina for transport. Of course, Japan played an important role at that time because in 1997 we had the Kyoto Protocols that were agreed here, and the Kyoto Protocols were agreed here, and that was a very important planting of the seed for results-based in climate finance, which came in 2005. Then later, the Millennium Development Goals were agreed, and then the Kyoto Protocols came into effect in 2005, and carbon finance, which is a form of results-based financing, was introduced. Later, there was results-based financing in health, and then in 2010, social impact bonds, development impact bonds became in use, very limited, but starting to grow. And then, of course, in 2003, as was mentioned, GPOBA began and started in 2005 to begin with subsidy programs. Of course, now we have the SDGs, and we have almost 14 years of experience now with GPOBA and the sorts of results that we have been seeing in our projects. Major RBF supporters include the Nordic countries, Norway, Sweden, and Denmark, the Netherlands, Switzerland also, and now DFID was one of the founding donors of OBA. Also, the World Bank Group is involved, the Inter-American Development Bank, KfW from Germany, USAID, the Gates Foundation, and then a more innovative approach outside of development is related to science with the X Prize, which is a form of results-based financing. So despite all of this increased infrastructure investment, challenges remain to improve the basic standards of living for poor people. And the challenges are ones that OBA is designed to meet directly, which is poor people in urban, peri-urban, and rural areas who lack basic access to services despite large investments in infrastructure, the public and private service providers who lack incentives to serve the poor in excluded neighborhoods. There's a gap between what the cost of service is and the user's ability to connect to the service or to be able to pay for the service. And there's very little accountability for results using input-based approaches. So that's, next slide, please, when results-based and output-based aid can be used. So output-based aid, OBA, is a results-based financing mechanism. It facilitates access to basic services for the poor, and it's paid upon achievement of pre-agreed outputs. OBA has been used in 7 sectors. It's been used in energy for grid-based connections and also for renewable energy of many forms. It's been used in water for with public utilities, which we'll hear about today, and also in small towns. It's being used now in irrigation as well. It's been used in sanitation, which we'll hear about today. It's been used in solid waste management, also in health, in education, and in information and communications technology. The way that OBA works is to bridge the gap between the total cost of a connection and what it is that the household, the poor household, is able to pay. So the household would have a very small amount, say $15, that they could pay towards a total connection cost of $100. Service provider could pay an additional, say, $25 that they would invest towards the $100. And then the OBA subsidy from one or more donors could make up the difference then to connect the household to water or to energy or other services. And in this way, the poor household is able to access the service and then pay themselves on an affordable basis for the monthly utility. As Carmen mentioned, GPOBA has reached over 9 million people. We have over 46 subsidy projects, and we have TA, technical assistance and dissemination activities, over 188 projects so far. We do a lot of evaluation, analysis, and knowledge dissemination. And we're going to hear today about 3 specific projects in Indonesia, how the government has used independent verification agents to improve the results that they see from the transfers that they make from the central government to local governments, and they improve the results for which those grants are directed. In Nairobi Water, we'll hear about from our colleagues how the public utility is using OBA to increase connections in households that have not been connected in poor areas. And in Bangladesh Sanitation, we'll hear about how government and microfinance together are used to support improved access to sanitation. So I'd like to turn it over now, please, to Nandia in Indonesia to talk about the project there.
Thank you. Thank you, Catherine. Thank you, GPOBA and TDLC for this opportunity. Can you all see my presentation?
Yes, we can. Thank you.
Okay. Yes. Okay. Thank you. So I would like to make a short presentation on our experience with the independent verification agent, as Catherine mentioned in her speech earlier. So I will start with showing you the map of Indonesia. So prior to the LGDP project and prior to the support from GPOBA, everything was just white. So when we started this project in 2010, using an output-based disbursement approach, we started with only 5 provinces across Indonesia. So here in this map, now you can see how the performance of these pilot provinces were since 2010 until 2013. This is before we did the additional financing. So prior to the additional financing in 2014, these are the data that BPKP show us. So BPKP is the Indonesia internal auditor, which is the independent verification agent that we use under this project. This is the PDO of the project to improve accountability and reporting. Why? Because prior to this project, there was no accountability or reporting in place for the intergovernmental transfer system. I would just focus on the IVA or the BPKP. BPKP is part of the component. So it's under the project component 3, which is the verification of outputs. At the request from the government of Indonesia, at that time, the Ministry of Finance requested the bank, if you want to have this project, then she requested 2 things. First, the TA or the component 2 of this project has to be fully financed by the national budget. So our IBRD loan is only for component 1. And then the second one is the use of BPKP or the government of Indonesia's internal auditor as the IVA, instead of using private sector such as UI and the others to do the verification of outputs. This is because the government of Indonesia thinks it's time for Indonesia to use their own government system to provide sustainability of the World Bank's project. So in the end, after the bank already go away and do not have any projects anymore, they can continue with the verification of outputs using BPKP or their own IVA. In the beginning of this project, we had several challenges. This is before GPOBA came to provide support to this project. We had many challenges because BPKP or the IVA, they're all auditors. So they're all accountants without any background of technical infrastructure verification. So this project reimbursed a slice of the government of Indonesia's transfer system on 4 sectors: water, irrigation, sanitation, and road. Initially, when we had our first discussion with GPOBA, there were concerns because most of the GPOBA projects usually are on water, sanitation, or other social sectors. But then we invited GPOBA to join our training for BPKP and to look at how we can provide trainings, technical trainings to this IVA on several sectors under infrastructure. Who are the instructors at that time is from the Ministry of Public Works Training Center. So this is this project with the support of GPOBA also encourage institutional coordination, which didn't happen before this project was in place. So we did several trainings for BPKP. Currently, we have trained at least 350 staff of the IVA across Indonesia. So then the GPOBA also support, instead of just capacity building, but also supporting us to provide a handbook for BPKP or the IVA and the local governments. So this way, the handbook can show them this is good road, bad road, and then how to measure them. The training provided by GPOBA also include in-class training and also in-field training. So instead of just listening to the theoretical, technical things, how to measure outputs from infrastructure sector, they also go to the field and really measure how to measure roads and the thickness of roads and look at irrigation and water supply. So these are the things that GPOBA supported the project under the TA component, which is the technical training that I have mentioned, the handbook, and then the modules for verification. This is very important for BPKP and the government of Indonesia because this is where the sustainability comes in. The verification modules that initiated by our capacity building, then it's institutionalized under the BPKP's training center. So actually, as the internal auditor, they have their own training center where they usually provide trainings only on financial management or procurement, for example. But now, after this project and with support of GPOBA, we've been creating at least 6 e-modules for verification of infrastructure sectors. In addition, we also provide M&E training. Why M&E training? Because before this project, it is very difficult for the government of Indonesia, which consists of several stakeholders, not just the Ministry of Finance, but also Ministry of Public Works and Housing, Ministry of Home Affairs, and the Central Planning Agency, to monitor the results of the intergovernmental transfer system. This is why we start providing M&E training for local governments, for central governments, and also for BPKP. In addition, we have developed a web-based reporting system under this project. What this web-based reporting system does is that it helps the IVA or the BPKP in terms of collecting reports from the local governments. Before this project, it is very difficult for the line ministries and the Ministry of Finance to measure the output and the results of the intergovernmental transfer system on infrastructure sector. So, for example, after the money goes to the local government's budget, whether it becomes 5 kilometers of roads or whether they use it to buy their new cars or build their own house, they don't know, because everything was done manually. And then under this project, we developed a web-based reporting system to support improving reporting and also accountability. After the additional financing in 2014, we requested to the GPOBA that it's time for us to do the dissemination. So we also proposed for support on dissemination, the SSKE, which is now planned for February. The idea is that after 5 years of implementation and the use of IVA, we would like to showcase to other countries within the region, in East Asia region, this is how a government system of IVA can work in a World Bank project. So these are the achievements of our project after 5 years of implementation, which at least 3 of them are really related to the successful of the IVA. So first is the strengthening of BPKP capacity. Now they're ready, at least 22 BPKP out of 30 BPKP representative provinces already been trained. So in total 350 staff within that 22 provinces. And now we're still down with 8 more, so we're going to provide more capacity building for BPKP plan for the next 2 or 3 months. And then it's also improved reporting and accountability. This is the very unique part of our project, which the Ministry of Finance already acknowledged that after this project, in terms of sustainability, this is the one thing that they have to maintain, which is the accountability from the BPKP results and also the reporting under the web-based reporting system. The impact evaluation, we've done some impact evaluation based on data provided by BPKP result from 5 years, that it shows that it's crowding in capital spending. So one of the challenges in government of Indonesia after decentralization era took place in 2001 is that how local government better spend their money. So this is something that we at least now have a baseline in the infrastructure sector. And another unique component of this project is that instead of just providing reimbursement of the intergovernmental transfer to the Ministry of Finance, we're also providing 10% of incentive to the good performance local governments. This is why this project output-based approach, RBF approach, is really working well in this project. It's because we also provide incentive or reward to the local governments, the good performance local governments. This is just showing that 1 rupiah of DAK spending now, it leads to at least 2.3 rupiah of capital spending or 25% of capital spending in the local governments participating in this project. We will go nationwide next year. So now we already have 267 local governments participating in this project. We started with 78 and 5 provinces back in 2010. Now already 22 provinces, 267 local governments. In 2017, we will cover the whole 30 provinces in Indonesia. So this is how the BPKP conduct their verification of outputs. The first thing is the use of reference unit cost. Reference unit cost is one feature of OBD or RBF. So it's the price that we already agreed with the government of Indonesia prior to the utilization of the AK. So it's not the true contract value, but instead we use this reference unit cost. The second thing is it's based on sample. So we already agreed with BPKP or the IVA that they will check at minimum 20% sample from each local governments. And then since their auditor and their accountants, for quality assurance, we still provide them with support from the Inspectorate General of Public Works, just to ensure that the quality of the verification results is technically sound. And then the last one is that because this is RBF, because this is OBD, so the only basis for the bank to reimburse our money to the government of Indonesia is based on the verification report from BPKP, from the IVA. So we don't do prior review, post review, but instead we do the pay based on the OVR. Since 2010 until now, on average, there have been like 1,864 contracts per year that BPKP checked based on sample basis. So we started there in 2011 until 2014. These are the main impact that we can show using BPKP as the IVA. First is the reimbursement results. This is the first thing that the government of Indonesia would like to see, which is the result, detail local government performance, and identify the overall accountability of LG spending. This is the main achievement from using BPKP as the IVA. And then the second thing is performance mapping. So in order for the for the central government to better allocate their transfer in the next year, so now they're able to identify the LG capacity, identify the needs, and also identify should there be any flaw in their guidelines. Because the technical guidelines produced by the line ministry is not rigid. It's flexible, so they can update it every year if necessary. So based on the report from BPKP, they can also adjust the regulations. And then the third thing, last but not least, is the data source for M&E. So the monitoring and evaluation is very tricky part of the transfer system. Because this is decentralized era, and then the money for local governments is the discretion of local government to use. The line ministry doesn't have authority to check or to monitor or to give sanction should the local government comply with the regulations. So through this project, finally they have a baseline. They will be able to monitor and evaluate what's going on through the BPKP report. Now, I want to show you how our web-based reporting system works. So this is the data that each local government put on their web. And then BPKP, when they go to the districts, prior to going to the districts, they can check by project, by location. So this shows which infrastructure sector, this is irrigation sector, which year, and then how much the contract. The second thing, when they click, they can also see the progress. The progress of the output. So the progress they can check quarterly. This is 30%, becomes 50%, and then in the end of the year they can see the full. So the fourth picture can show them the annual progress of the road sector, for example. So in this case, we can we can see that by the end of the year, the transfer system has to be completed only in one fiscal year. The calendar year of government of Indonesia is from January through December. So by December, the fourth picture has to be there. So they can check the output is there, good, so it's eligible. And then the second thing, that they have the pre-handling output given by the contractors by December 31st, then it's eligible. So these are how the BPKP also gain from the web-based reporting system that is also developed under this project. So prior to this project, as I mentioned earlier, there was no this system. Just everything is manual. With the support of GPOBA, we're able to, one, develop this system, and then second, expand this system. So the idea is that the Ministry of Finance currently have issued a ministerial regulation to expand this reporting system for all the transfer system, not just for the DAK, not just for infrastructure sector. So this is also the sustainability that we expect from this project. This is my last slide, is on the sustainability. So there are many things that we gain from this project and from support of GPOBA. Improve accountability. That's small picture. The second picture, small picture, is the handbook. We can show you the handbook later. The first picture is actually very small, but that's how BPKP actually was trained for how to measure the road. And then it's institutionalized under the BPKP Training Center. And then in the end, we want to showcase this. And we want to expand the role of BPKP. In the end, we don't want them to just able to measure outputs in infrastructure sector, but next, we want them to go to social sectors, health, education, and the others. So that's our experience with GPOBA and using BPKP as IVA. Thank you.
Thank you so much, Nandia. That's a beautiful illustration of how this results approach with OBA and building in the accountability and the incentives through the training, the monitoring, the verification, the incentives to the local government leads to impact at both the national and the local government levels, and most importantly for the communities that benefit from this infrastructure. Thank you so much. I'm going to ask you to hold your questions until we've heard from all three of our groups, and then we'll have questions at the very end. So I'd like to turn now to our colleagues from the Nairobi Water, Director Maguna, who's the Technical Director of Nairobi City Water, and also Director Randu, who's the Finance Director. And we can see your presentation on this end. So if you can please activate your microphones and please begin. Thank you.
Now, my name is Engineer Nation Mange Muguna. I'm the Technical Director and Nairobi City Water and Sewerage Company. We have been handling this project with the Finance Director from inception. This project is started sometimes back 2012. That's when we started doing the baseline study for this project to put together the documents. Then 2014, we were able to be given the money, around $4 million, to start our OBA project in 12 informal settlement of Nairobi, with the objectives of connecting poor households to the sewer. First, we have our constitution which guarantees water and sanitation services to the people at reasonable standards and in a healthy environments. Then again, the project or the goal of the project is to be sustainable and for the sanitation and water services to be accessible to a lot of informal settlements of Nairobi. Then we have the objectives of the project. The key objectives are connecting poor households to the sewer. We intend to connect in total 8,613 households. But the way they are clustered in two types of connections. We have those who have existing toilets which are not connected to the systems, but they are poor systems. They drain their waste to septic tanks or to the open drains, but they are wet toilets in short. They are roughly 4871. Then we have those ones which are pit latrines, which we must upgrade to poor system, connect them to existing sewer network. They are 3742. Now, why are we doing that work? What happened is sewer lines were done under WASI program, but the uptake of the connections was not there because the access is prohibited or hindered by the changes done by the water company, that's Nairobi City Water and Sewerage Company, and also the cost of the materials to do the connections. So you find you have the sewer network, but people are not connected because of that cost associated with the connection of the services. So the project was conceptualized to ensure that yes, we have the sewer lines. How can we make sure that these poor people access the sewer systems? So we conceptualized this project. Then the second objective is to connect still those poor households with the water. We have some of them who do not have water connections, although there is sewer lines which have been done in that area. So for you to connect them to the sewer system, then also you must connect them with the water system. And also out of the same program, we have a resettlement program under the Kenya Railways upgrading program, where we have constructed, or the national government has constructed houses for the people who are living along the railway lines, but they do not have water connections. So under the same program, we are connecting 64 that I think we are connecting around 4,600 in the railway program, and the balance of 64, the balance out of 64 that 8, we are connecting people who are living in the poor informal settlements. Then the next objective is, of course, to collect revenue out of what we are doing, so that the project can be self-sustaining and also you can be able to do operations and maintenance in those areas. Of course, before the company was not getting any revenue out of these settlements, but we believe, because already we have piloted a small section, or we have finished a small section, we believe we will get revenue from the projects when it is completed. So far, we have done around 1,200 connections of sewer together with the water, and the people are paying through a process we call M-Pesa or Maji Mashinani program, where they pay as they consume the water. The fourth objective is to enable those people who live in these settlements, live in clean and healthy environments. And out of this, we are doing outreach to the community to show them the benefits of getting sewer connected to them, how waterborne diseases will go down in the areas, because at the moment they are draining all the wastewater to open drainages, where you find small children are tampering, or they are playing with that water, and then, of course, they contract waterborne diseases. This fourth objective involves a lot of outreach and social work by our team, where we are doing it with the company and the World Bank. Of course, the World Bank is bringing the expertise in hygiene and education, which I think they are experts. Let me say that, because I've seen the way they are approaching it. It's not different from the way we used to do it before. Then we are also trying to train the people on how to use the toilets. Now you can see where we are working. That's the map of Kenya. No, the map of Nairobi, where we have 12 settlements where we are working, or 12 poor villages or communities where we are working. By the way, Nairobi has a population of around 4 million, and around 40% of those 4 million live in the informal settlements. So in those informal settlements, we don't have water and sanitation services. So now we are trying to improve them. Then the structure of the program is we are getting $4 million from the OMBA projects, and then the company is getting a loan of $6 million. So in total, the project is around $10 million. We don't get the money on behalf of the community, but after finishing the program, there are some indicators which we are supposed to be meeting based on the OMBA documents or based on the OMBA loan. After the work has been verified, it has been done, we are supposed to be getting some grants. Whatever will not be given as grants, we are supposed to pass to the people who are benefiting from the services, where they will be paying that loan for the next 60 months. That's 5 years. So, in essence, the community is benefiting. The Nairobi City Water and Sewerage Company is also benefiting because more or less they are providing the services earlier than they should have provided through this OMBA program. In this plot, where we are providing the services, you'll find most of them, they have 2 toilets, and one of the other door is supposed to be a bathroom. Now, because in Nairobi, the supply of water is less than the demand of water, therefore we ration the water. We have provided for the tank where the water they are using to wash their clothes can also be stored in a tank, and then they get that water to flush the toilets, or rather pour into the toilets. So we are trying also to economize the water there. We have also provided a wash hand facility. That's after going to the toilet, somebody should do a wash program or washing your own hands, so that we can reduce waterborne diseases. That's why you can see there is a 20-liter wash hand facility, and then we have the 400-liter plastic storage water tanks, because water is intermittently supplied in those settlements. You can see there the way the toilets were before. That is, you can see some of them are pit, others are just, actually they are pit latrines, in short, those ones are. Then after they are modified, you can see they become a better facility for the people. This is not the completed facilities at the far left, where you can see the blocks, because we are changing them from manned to blocks or permanent walls. These are still under modification, they are not yet completed. But there is one on the side, on my right-hand side, which is more or less complete but not yet complete, and that's being worked on. So, what have we learned out of this program? What I can say is, one, the company is taking the services to the people earlier than it should have. The people should have received the services. 2, we are eradicating waterborne diseases in those areas, and then enabling the people live in a good environment. Number 3, the company is going to get revenue out of this program in areas where it was not accruing in revenue. Number 4, it's more or less a training to to our people, or capacity building to our people to provide services in low-income areas. So this program has come the right time for the people of Nairobi, and we are very thankful to the World Bank for providing this money to serve the poor in Nairobi. Thank you so much.
Thank you so much. Please go ahead, Mr. Randu.
Thank you. I think he's said more or less given the project overview. Mine is just to emphasize that for Nairobi, as our utility, these are areas where we were not getting much revenue. And as some of the photos are depicting, the environment was not conducive even for the people who are living there. Maybe to add, how we are administering this is the people who are connected, the customers, the amount that is not coming in as a subsidy will be paid over in 60 months. And it is small amounts that are affordable for them. And this will be done, or they're being done in the places where we already successfully piloted through mobile telephony. So even the way they are billed, the billing for the services rendered, that is water and sewer, is they get the reading for the meter, they send that reading through the phone, they receive a bill immediately, and they send the money through the mobile phone to pay that bill. So there is conveniency, and there is that outreach after the awareness which was created in these areas. Thank you very much. Thank you.
Thank you so much, Mr. Randu. So that's another beautiful illustration in a completely different area where a public utility has been able to use the large investment that's been made in infrastructure. The poor households cannot afford to connect to the sewer network, so a subsidy is needed to bridge that gap. The households, as Mr. Randu just mentioned, are paying for the services after they've been connected by mobile phone. And then the community is improved in terms of their health, not only the services, but also in terms of the health, and then also their ability to work and live safely and productively. Thank you so much for that example. I'd like to move next, please, to Rokeya Ahmed in Bangladesh, in Dhaka, who will talk with us about the sanitation project.
This is I'm presenting. This is a project on sanitation marketing. If you think about this thing, that Bangladesh is a global example for eradication of open defecation. It's a very short time, and now only 1% people in Bangladesh are defecating in open places. That's mean 99% have access to toilets. But unfortunately, we miss the opportunity to achieve the MDG goal on sanitation, because our improved sanitation coverage is only 61%. There are many reasons for this. Now the country is looking very much how they can support the people again to move up the sanitation ladders. And to moving up the sanitation ladders, there are a few problems and challenges. And our project is actually working to support the government to overcome the challenges. So the key problem is the most of the toilets, that is actually it's the basic toilets, and this is a direct pit, and water seal is broken, low quality, constructed by the people themselves, and this is a very high risk of contamination during desludging or emptying the pit. Because this is actually mainly homemade toilets, and entrepreneurs are mainly supporting for constructing this, selling two parts of these toilets. So there is if even people want to buy some better quality of toilet materials in the rural market, supply is not there. So in the urban area, people are selling the materials, which is mainly for the middle class people and upper middle class people, but there is very few materials available in low cost which is affordable for the poor people. The current growth of improved sanitation is only 1.1%. We are discussing a lot about how the country can achieve the SDG goal. To achieve the SDG goal, the required achievement is 2.5%. That means more than double of the current rate. And it requires actually the 60 million people to construct or renovate the current type of toilets. It's a huge task for the country. In Bangladesh, one thing is very positive, that we did a study in 2010. We found that more than 80% of people constructed the toilets using their own money. The subsidy is only for 20% extreme poor people. So that means that people do not have that much of expectation of huge subsidy from the government. And considering all of this scenario, from Water and Sanitation Program of the World Bank, we did a pilot and to support the country how to roll out a new model in Bangladesh by bringing together domestic private sectors. There are more than 10,000 small scale, very small private entrepreneurs who are doing this business, and Bangladesh is famous for microfinance. So Microfinance Institute and the very poor people for a bottom-up approach, so people can move the sanitation ladders. So what we did, we tried to bank the unbanked, that the people who do not have access in a commercial bank, these small-scale sanitation entrepreneur, they are only maximum 5th grade education they have, and they don't have the asset to give a collateral. So these people, and how these people can serve the poor people, and how these sanitation entrepreneurs, poor people, MFI, NGOs can have a partnership, so the local government can help these people to move the sanitation ladders. So through this, what we tried, so you are seeing the pictures of a basic toilet. It's a photo of a basic toilet. It's a plastic pan. It's a mudded floor. And these people to move up the sanitation ladder. So from these basic type of toilets, people can move him up a better toilets. And these toilets is cleanable. With a proper super toilet house, and most importantly a lockable door, which is very important from the gender point of view. That's the full toilet we tried to put in one structure. And the other thing, that the basic toilets, they are separating the human feces from the environment, confining, but cannot actually block the germs transmission, which is very important to getting the health impact from a sanitation coverage. So we considered both the health impact and also people comfort, convenience, and especially the dignity, which is very important for the use of to ensure the use of the toilet and sustainability of the use also. So the key activities what we did in the pilot phase, we found that to promote a market-based approach, we need new types of product. So we did a action research to bring new types of product in the market. So we have designed mainly two different types of toilet. One is prefabricated toilets, so people can buy all the materials from the market, even by themselves they can construct it, and another requires on-site construction, little bit high cost. And for the market development, we provided capacity building support of these small scale sanitation entrepreneurs, so they can produce and sell the full toilet. Not only that, we supported them for marketing their products by themselves, because in most of the cases in Bangladesh, the demand creation was done by the health workers or NGO workers. So to reduce this health workers and NGO workers' role for the demand creation rather than a market-based approach. So, but this toilet is little bit expensive than the basic toilets, and these sanitation entrepreneurs, they did not have sufficient capital to invest to promote their business to sell these new types of toilets. So what we actually did, we linked these entrepreneurs with a microfinance institute to give them loan. And first we actually did not think of giving loan to the customers, but after 1 year we realized if the customers don't get the loan also, the poor people cannot afford the full payment at a time to purchase the toilets. And later we also introduced requested the microfinance institute to give the loan to the poor customers. That actually helped us to more than around 2 million people in last 5 years to move up the sanitation ladder, and which was actually beyond our expectation, the success as a pilot, and very good encouragement for the microfinance institute, as the recovery rate was almost 100%. And this actually this also help us, a huge network of microfinance institute, to take the program to the doorsteps of the poor people. So it's a combined effort by the small scale entrepreneurs and MFI workers for the demand creation, and people are getting the service from their home. And finally, we tried to mainstream this sanitation loan into a public financing institute, where actually GPOBA support we have linked. Very important role it's played. So in Bangladesh, there is a institution, it's PKSA, Polli Kormo Sahayak Foundation. It's a public financing institute. They get loan from government, central bank, to give loan to the small microfinance institute, to give loan to the households, and also for SME, small scale private sector development. So we lobbied a lot with them, and finally they agreed to give this loan to the 21 MFI. So one MFI is a very large scale MFI, ASHA. They have also credit program in 15 countries. So ASHA is the organization who supported us for piloting this thing. We give them the capital. This is their own capital. And in this new initiative also, they will use their own capital to support 170,000 people, households. This is around 1 million people, to construct this new type of toilets. And after construction, this new type of toilets, this from the loan of MFI, the output based aid, we will provide around 15% of this total cost of the toilets. Yes, that will be one kind of encouragement for the poor people to install a toilet. The second thing, this will help to reduce their burden of payment of installment. We also motivated the MFI to extend the period of loan payment, the tenure, So that is also this whole kind of thing. And GPOBA, the final thing that we have set up is paying for the monitoring of the IVA. That will ensure the quality, also transparency, which actually support the create an example for the country. That's a quality toilets can be actually help the people to in a transparent way. And this is an example for Bangladesh that microfinance and private sector can work together. This is a public-private partnership and also partnership with MFI. So this is a new initiative for us, and we just started this project, and we hope that after a year we'll be able to share the success of this project. Thank you very much.
Thank you so much, Rokeya. That's a beautiful example, again, of how I think you can see all of the common threads that come together across these three projects. So there's a government strategy, and there are policy targets that are identified. And then in each case, a results approach was used. There's leverage and co-financing. In Indonesia, that was from local government. In Kenya and Bangladesh, there were user fees and then user contributions and then also local financing. And then there's the monitoring and verification, which is the critical aspect of the output-based approach. So no payment is made unless the outputs are achieved according to the quality standards that are required. So there's a substantial risk transfer, and then there's the idea that one is not making any payment at all unless you actually achieve the results. So I'd like to thank all of our presenters and then ask the audience if there are any questions specifically for the teams or in general.
Hi, I'm Lauren. I'm from JICA's evaluation unit, and I was wondering how you arrive at a number for the gap, how you determine what the gap is in the financing, and if you could talk a bit about the process that you go through to arrive at that, that would be informative.
Why don't we take several questions together, and then we'll have the teams answer them, and we can answer them here.
So, Catherine, just to add to the question, I think also in terms of calculation, how is the duration of the OBA grants determined? In terms of, is that negotiated? How does, in terms of winning over stakeholders, how, and service providers, in the sense of if a duration is determined, how, what are the contingency plans that are put in place when the OBA grants maybe will no longer be there, so that the service continues to be provided to those in need?
Hi, I'm Takiro from Japan International Cooperation Agency. This is a more general question, but I'd like to ask, what is the buy-in for the client to use OBA? Because for me, it seems like input-based aid or output-based aid, as long as you can achieve the outcomes or goals you define, it's the same thing. But how would you convince the client or the recipient government to use OBA instead of input-based aid?
Great questions. Thank you so much. I think actually I'm going to turn to the project teams. Rokeya, do you want to give an idea of how the subsidy was calculated for Bangladesh in sanitation? I know you did a lot of preparation work on that.
Thank you. In Bangladesh, we did a small pilot, I told. Then after the pilot, we have done an evaluation. In the evaluation, we found that the 12 to 15% people, those are extreme poor, they actually could not afford the loan with full interest. Then we have also collected data from the, where we had a project and where we randomized trial control villages and treatment villages. So, and from this study, we talked around more than 2,000 families, and there we calculated the subsidy. one thing. And the second thing, that the interest rate in Bangladesh in the Microfinance Institute, that's we actually checked the interest rate with Microfinance Regulatory Authority, and from there we found that the average interest rate is in a flat rate is 15%, 12 to 15%. In a declining method, it is 25%. So from this study and the data from the microfinance credit institutions, we have compared, and finally we had several meetings with government agencies, microfinance agencies, and we worked together with GPOBA and finalized the subsidy, amount of subsidy.
Thanks very much. In Nairobi, Mr. Maguna, Mr. Randu, do you have anything you'd like to add as to how the subsidies were calculated and the willingness and ability to pay related to the project? I know you also did quite a lot of background work in that, and especially Mr. Maguna, that was your deep project for a long time.
What we can say for Nairobi, it's more or less what happened in Dhaka. There was a pilot which we ran and it was successful, and from this pilot we now upscaled it. What I can add is these targeted areas, people tend to live in we call it like a microeconomy. They purchase in small quantities, hence the idea that we give them the ability to read their own meters and getting a bill maybe even on a daily basis so that they are able to pay. So that is the idea behind it. But we did the pilot, we did the socioeconomic survey of the study of the area to determine maybe the affordability, the economic status, how much they can afford. And from there now it's when we determine the amount of subsidy for the project. Thank you.
Thanks very much. And would you like also to address maybe the issue of why this was appealing to you to participate in a results-based approach like this? What was attractive about this to the utility, to Nairobi Water?
Now, what actually attracted us to this program is there is need for the services in those informal settlements, and it is the responsibility of the company to provide those services, but there was no money. Now, somebody tells you, if you do this work, I will give you a rebate or I will give you a grant to this equivalent. So the incentive is actually the rebate which the World Bank is giving to whoever meets the performance indicators. And of course, there is no way I can fail to meet the indicators because I must make sure I get this rebate for the people or for the poor people to benefit. Otherwise, when you look at it, as a company, there is normally no need to take the services to the poor because they may not afford to pay for them. But if there is a rebate I'm getting, I will do that. And that's one of the reasons why we took the OBA program very seriously. And in fact, even when we finish this one, we will upgrade it further. Thank you.
Thank you so much. Nandia, in Jakarta, would you like to share with us the government's perspective on why this was so interesting for the government of Indonesia to take this results-based approach?
Yes, so for Indonesia government prior to this project, all of the bank loan was input-based. And then some of them very successful, the others not very successful. And then they're thinking about how we're going to move towards outputs and outcomes. At that time, since we haven't had any baseline for outputs, so we said to them that it's easier for us to start with output-based since we didn't have P4R at that time. So that's why they really want to move towards an output-based approach, which we're focusing more on the output produced at the end and not really focusing on the process. So that was their intention. Now, after 5 years, they're thinking about how we can move forward towards outcome-based.
Thank you so much. Mr. Randu in Nairobi, you mentioned a little bit about how the consumers or the households themselves are monitoring their own use of the service, and that helps to make the project affordable. So that goes a little bit to Dan's question about how things are sustainable after the subsidy ends. I know that in power projects as well, we have, for example, prepaid meters that we're using in Nairobi in the energy projects there, so that we're sure through the affordability studies that are done, the household studies and the willingness and ability to pay, that people are then able to monitor their own usage so that they don't become indebted, overly indebted, and it keeps the basic service affordable for them. So thank you for that. Are there any other questions we could take from the floor?
Hello, thank you very much for your good presentations. I'm from a public health sector NGO. I have one question. Are there any incentives or conditions according to the levels of achievement of the project activities?
Yes, thank you for that question. So especially, they are in every sector, and especially in the health sector, those are related to the outputs that are paid for and then the indicators that are achieved, and there are quality parameters that are associated with each one of those outputs. So for example, if you look at maybe a maternal and child health project, you would have a series of visits that would be needed and a series of services that would be provided, and you would pay either incrementally or as the entire package is completed for something like health services. And there would be quality parameters as well as the individual services that would be included in that. I'm sorry?
Does the amount, for example, of the disbursement matter according to the levels of achievements?
In a pure OBA project, no. But if you do RBF, yes. And I think, as Catherine was trying to say, especially on health projects, we have seen it to incentivize the doctors of the midwives to provide certain quality of service. But if it's a pure OBA, no, you assign and predetermine before what is the disbursement, the amount, and either you will get it or not. So let's say it's a connection for water, and you're agreeing that it has to have certain quality, the water and pressure and all of that. Let's say there's 5 indicators. If the 5 are met, then if we say we are, paying 100%, we're paying 100%. If 3 are met, it doesn't mean pro rata, you get it. You will get 0%. So, but in more RBF style, yes, there is incentives to incentivize the providers.
And there's quite a lot of work in results-based related to health. So that's very important. Other questions, discussion?
I wanted to add to the question on how do we set the subsidy, because the 2 cases you heard, they both started saying we had a pilot, and you probably wonder, well, if there is no pilot, how do you come to the subsidy? So again, the equation is very simple. You do a study of ability to pay and willingness to pay, and sometimes you'll be surprised. I did a project in the health sector in Nigeria, and you will always think that the ability is always lower than the willingness, or people are less willing to pay than what they're able. Actually, in that case, because it was an insurance that they didn't have, that they felt it was important for them, for their health, they were willing to pay even much more than maybe what they were able, which was unusual. So it's always good to do these studies. And you do it based on a sample, right? Because you kind of go to everybody that is going to be your target. So you will start with that. Then you need to do a very thorough analysis of what is the cost of providing that service from the service provider, whether it's public or private, to make sure also that the numbers are not being inflated, right? And you do your typical financial analysis and economic rate of return. And really what is the gap is what the subsidy will be. So if you don't have a pilot, and let's say you're in a sector, in a country that you don't really have much of a benchmark, what you will do is you will look at similar sectors in similar countries. So, for example, we were doing also, it was a health project in Yemen. And actually it was very complicated because they wanted to have biometrics. So women, because they're covered, the only way to make sure they were themselves, it was with getting their picture of the eye bulb, the eye iris, whatever you call it. And actually we had to look at places that they were doing the same thing in the United States or in Asia to get a benchmark of whether, the cost was reasonable or not. So if you don't have pilots, you will really go with benchmarks in other countries to get a sense. Mm-hmm. And if you don't have it, well, maybe you need to do more of a technical assistance to invest. But the subsidy calculation is super important because you don't want to miss it one way or the other, right? If you go too high up, you might not be really doing pure subsidy. If you go too low, maybe the incentive is not there for the service provider to be efficient, which is what you want in the system.
And then to address Dan's question on sustainability, that's very much linked to the ability and willingness to pay, and it's linked also to the selection of projects from the beginning, because you can't have a project that will be successful in the long run if it's overly subsidized and people can't afford to pay for it in the end. And in that case, if the studies show that there's not the willingness and ability to pay, then it's really not a project that would be well served by using or necessarily using this sort of results-based approach. And then you might want to look at other types of interventions.
If I might add to that, because that's a very good point, sustainability. And what we have encountered is that the hardest projects for us to justify sustainability, believe it or not, are the health projects or the social projects, right? In water and energy is so much easier. And actually we have a rule of thumb that the way we justify the sustainability is that we pay part of the subsidy when the connection is made, and we wait to pay for the other part of the subsidy when we have seen that, for example, I don't know, for a year or for 6 months, the service has been provided. So let's say you really get in when you're opening the tap, the water at the level that you need to be getting, or you're getting the electricity so that the utility has no pull out, right? But in the health projects, it's much more complicated to see the sustainability. And if you take, for example, as Catherine was saying, a safe motherhood project, well, it's even more complicated because let's say if we are intervening for 2 years, babies and pregnancies are for 9 months. So, the question is, well, if you have provided service for, 10,000 women to deliver babies, who is coming in for another 10,000 that will come later on if the subsidy is not there? So what you need to create is more of a system and a policy that then, the government or other donors will have to come in to make it sustainable in the country to be providing that service. Again, in the case of water and sanitation and electricity, it's so much easier, but also it has some complications sometimes as well, right? But it's easier to see the sustainability angle. And maybe that's why GPOBA was very strict, and most of the subsidies they give used to be for connection. And very often what we found, especially in energy, is that the willingness of people to pay for electricity was incredible because of what was their plan B or whatever they were getting the electricity. Let's say in Ethiopia, we're doing rural electrification. And these were really poor areas in rural areas. And people were willing to really pay the cost of half of the connection and then getting the service because, believe it or not, it was cheaper than paying the money under the table to the neighbor to get the connection illegally, which also had some implications in terms of security, or because they were using a fuel that was no good for the health of their kids and things like that, right? So sometimes when this willingness and ability to pay studies are very revealing because what is the other option that these poor people have? Sometimes it's more expensive in the long term, right?
That's a great point, Carmen, and I think our colleagues in all of the projects that were presented today have touched on something that we didn't talk about explicitly, which is behavior change. And if you look in Indonesia, The national government has instituted behavior change in the way that they pay. The local governments have responded to the incentives. They're participating in a different way. They're participating more fully, contributing themselves, and also changing their own behavior in terms of the results that are provided through the work that they do. Mr. Maguna and Mr. Randu talked about behavior change and outreach in Nairobi, about how reach into the households was needed to explain to people why do they need to participate in this project. Why is hand washing important? What are the benefits to them of using these water systems, and why would they want to participate? And the same thing that Rokeya described in Bangladesh. Why would households want to borrow money to make the investment in better toilets, in these better quality systems that were being offered? So there's an element of behavior change, there's an element of education that's needed in all these things, not just the incentives, it's not just the subsidies, but demonstrating what the benefit is in the long term. And I think that's been true in all of our projects. Okay. I'd like to thank very much all of our colleagues. First, Nandia Yuwono in Indonesia, thank you so much. And our colleagues in Nairobi, Mr. Maguna and Mr. Randu, thank you very much. And in Bangladesh, Rokeya Ahmed from the Dhaka office. And I'd like to thank all of you here for participating, and we hope that you will continue the dialogue with us on OBA and RBF through our website and through our community of practice. Thank you very much.